Welcome back to another episode of the Community Connection. Today we are joined by Dr. Ardedra Rogers, PT, DPT. Dr. Rogers received her degree in exercise science from Norfolk State University in 2017, and she also holds a doctorate in physical therapy from FAMU, which she earned in 2022. Dr. Rogers specializes in pelvic floor therapy and is currently serving the Hampton Roads community at Dominion Physical Therapy and Associates in Norfolk and in Hampton. Dr. Rogers, thank you so much for joining us today.
Thank you for having me.
Absolutely. Could you start by explaining what is considered to be the pelvic floor, what pelvic floor therapy is, and why it's important for both men and women?
Absolutely. So pelvic floor physical therapy, just to make it easy. So as a physical therapist, I specialize in dysfunction of muscle, joints, and bones. So just like you consider like muscles of your arms and of your legs, our pelvic floor consists of the same muscles. And those are muscles that kind of support our genital region, and both male and female both have a pelvic floor. The importance of addressing that are several topics that come up throughout the lifespan, whether that's for females, it may be issues that stem from pregnancy and postpartum. So, like pregnancy issues would be that low back pain, that pelvic pain, and there's a condition called diastasis recti. Just to kind of give you a quick rundown, as if you have, these are my six-pack abs, right? Check me out. So, and right where my knuckles are lining up, that is where we have connected tissue for our six-pack abs. And as baby grows, your body's going to have to accommodate to that, right? So a lot of changes are going to happen in the body, but as a baby grows, some women may actually experience abdominal separation. As far as the postpartum side of things, there's a condition called incontinence, and that can happen during pregnancy and postpartum. So whether a woman sneeze, cough, and laugh and has a little trickle, feel the need to go to the bathroom and you're like running to the bathroom, barely able to make it. Constipation issues stemming from that can also be painful intercourse. And then I also deal with like SIJ dysfunction, so like hip joint dysfunction.
Okay. So, what do you feel like are the most common misconceptions about pelvic floor health, and how do these misconceptions kind of impact people that are seeking treatment?
Okay, so when it comes to those issues, a lot of times men are unaware that they have a pelvic floor as well. And so just kind of letting both genders know, like, hey, we both face very similar issues, but especially in the women population, we like to talk. So we tend to talk about our issues a lot more. And so, and even still with women being more chattier, we also have a lot of taboo within the pelvic health community. So one of my biggest things is education. So again, don't feel like you're alone when you're going through your problems. About everyone at some point in their life will have pelvic floor dysfunction, and to know that there's treatment for it.
Okay. What are some signs or symptoms that might indicate someone should consider seeing a pelvic floor specialist like yourself?
All right. So with that, when things are no longer out of your control, some things in life you should be able to control, but when you get to the part where you can't control them, yeah. And when I say that, I'm referring to urine and feces. So certain little activities such as walking, lifting something up, that shouldn't be triggers for you not to be able to control your bodily fluid or matter. And additionally, if a female complains of like vaginal heaviness, and a lot of times, people will initially say like, hey, like I feel something heavy. And so that may be indications that there's a prolapse. And vaginal prolapse, that can be whether the uterus, the rectum, or the bladder is actually descending in the vaginal canal. And so, I've also had complaints of if a woman like, actually takes a mirror and she holds it down to, see the vaginal area, she'll be like, hey, I see something. So, yeah. So there's visual signs, there's the physical signs. If something that wasn't a problem before starts to arise, so like say intercourse wasn't a problem before that was painful, and now you've had a baby, something traumatic has happened, and now you're experiencing painful intercourse, those are kind of signs as well.
Okay.
And to mention, especially if someone's undergone, so for the male aspect, if someone's undergone cancer treatment, that in itself could be a sign that, hey, you might need to see a pelvic floor physical therapist.
Okay. So how does the assessment process work And what should a new patient expect during their first visit?
Oh my gosh, that's my I love that question. I love that question because I feel like so many patients show up to the office unprepared. So the first day, like I love it because I have been on the other side of that, so I know what patients need. So the first day, I welcome you to the party. I greet you with a smile, like, "Hey, I'm Dr. Rogers. Welcome to the party." And so I just start talking to my patients because at the end of the day, I always start off with, "Hey, I'm Dr. Rogers," but throw all that in the trash can. Especially for a woman, I say, "I'm Ardedra," and as a woman, I see you and I hear you. So I don't ever want you to feel like you don't have a voice. I don't ever want you to feel like, I'm gaslighting you. That's not the case here. So definitely kind of building that rapport is I don't want you to see me as, hey, you're the doctor. I'm going to do whatever you say type of thing. No, we're working together. This is collaborative care. But I tell my woman, I usually have a model that represents the pelvic floor. And again, I tell her, your no is a full sentence around here. You could tell me no, I don't feel any type of way. I don't press you to do anything you don't want to do. And I go through the examination and I tell them what may have taken place in their body, and I tell them the reasons why I'm doing what they're doing because I always want them to make educated decisions. So once I kind of go through my whole home house rules, then I kind of walk through the examination process. And I tell them, that this part, I need your consent for it. It's okay if you don't feel like doing it today. It's never a rush because I can make it happen, regardless whether I do it or not. But I walk them through the examination process and I let them know, like, it's physical therapy like anything else, muscle, bones, and joints. But this just happens to be a more sensitive area. So, with the examination, I tell them, you do undress from the waist below, and whether it's a urinary problem or a bowel problem, I'm just kind of assessing to see if those muscles are weak, if those muscles are uncoordinated, if those muscles are poor endurance. So I just kind of walk them through everything, and then I also give them a chance to make those informed decisions, like, hey, I'm okay with this, or no, I want to hold off.
Okay. Okay. So, could you discuss the variety of treatment options available and how you personalize care for each patient? You've talked about that a little bit in kind of the initial exam,
Mm-hmm.
but moving forward in their care, what does that look like?
Okay, perfect. So it's kind of like a spectrum of things. So we have a group of, muscles that are weak and uncoordinated, and then muscles that are too tight. So we'll start with the weak and uncoordinated patients. So first day, I like to establish their goals because again, we're working together, right? So I want to know what it is that you want to get out of your therapy because each patient, I'm going to tailor it to your needs because if you can see yourself progressing towards those goals, you're more likely to adhere to those exercises. So for my patients that may have weakness, such as like incontinence, I'm going to develop a plan after I've done the initial assessment to address their deficits. So it could be strengthening the core, especially for those patients that may have diastasis recti. People don't consider, but there's a lot of research linking hip dysfunction and low back dysfunction to pelvic floor. I may be including exercise to strengthen the hips and lumbar range of motion or strength because, again, it all ties into the pelvic floor. Additionally, everyone goes to those standard Kegels or Kegels. Most women have no clue what they're actually doing, honestly, when I exam. And so let's talk about it. So, a true Kegel is if I had my finger inserted during the examination, there's not just a squeeze component, but there's a squeeze and upward lift towards the head component. So ultimately, that's what we're trying to work towards if the woman doesn't even kind of know what to do. So starting off there, then we kind of tie everything into it. So if running is one of her goals, she wants to be able to run, she or he wants to be able to run and not urinate on themselves. So ultimately, we're going to start, then we'll progress to sitting and doing it. Then we'll progress to standing. And ultimately, we'll start doing more like low impact activities. So it's a progression where we kind of implement everything and bring it together. And then on our other side for the tight muscles, so a lot of that has to deal with body awareness. So a lot of times, like, we don't even consider like our daily activities of, do we tend to be more anxious than, not? Because a lot of times people don't consider like breath holding. People hold their breath and they're unaware. People tend to squeeze their glutes and they're unaware of that. So just kind of behavioral awareness and making modifications for that. But I also have tools called vaginal dilators. And to the site, people be like, what are those? But pretty much they're silicone devices that I use, and they can start off as small as my pinky and progress to larger and wider sizes. And pretty much what I use that for is like a added tool, just to be able to get those muscles to relax better and prepare for pleasurable intercourse or even like women's wellness visits, different things like that.
Okay. Okay. Can you share a success story or a particular rewarding experience that you've had in your practice?
Oh my gosh, yes. I feel like all my patients are a success story because by the time patients find out pelvic floor physical therapy is a thing, they've dealt with their problem for so long.
Mm-hmm.
And especially with certain healthcare practices right now, there's this whole stigma. Oh, I hate the saying, it's you're getting older. And my whole thing is it's not normal, but it's common. So I like to debunk that from the beginning. But some success stories. Let's see. Okay, so I had a woman that had been married. She had been married for like 20 years, and probably at the time when I've seen her in the last like 4 years, she probably had sex maybe like 3 times. And so just being able to work through her process and to hear her story about how she felt like her marriage was restored, how she, the things that was important to her she wasn't able to do, and just being able to communicate with her partner, have her partner come in and get a better understanding. And at the end of all of it, he came in and he told me, thank you. And yeah, and just the joy from her herself.
Yeah,
So, yeah.
that's awesome. So for listeners that are interested in learning more about pelvic floor health, or if they're interested in seeking therapy, what resources or first steps would you recommend?
You've come to the right place. So of course, like pelvic floor is spreading like wildfire. I would definitely say like you can find it everywhere. If you're on social media, you can find it on social media. I would definitely say check your resources. Just because everyone has knowledge doesn't mean that they're credible to kind of speak on it. So, and then even if you find something and you feel like it's something that's beneficial to you, your doctor may not even be aware for it. So I always implore like my patients to be your own best advocate. Just because someone's not given that opportunity to you, you have now been impacted to take information to your doctor to say, hey, I think I'll benefit from this as well. But yeah, worst case scenario, demand physical therapy.
So Dr. Rogers, you are seeing patients at Dominion Physical Therapy at both the Hampton and Norfolk location, correct?
Yes, ma'am.
Awesome. Awesome. So this is a question that we're asking everyone that's coming on the podcast. So we want to include you as well.
Okay.
What do you love most about living and working in the Hampton Roads area?
The diversity. Because this is such a big military community here, you get to meet so many people from different walks of life, whether that's like culture, religious. You get to meet a good mix of everyone, and so it's almost like I get to travel through my patients. So I enjoy that.
That's great. Well, thank you so much for joining us today.
Thank you for having me.
Appreciate it. If you are interested in setting up an appointment with Dr. Rogers, you can call the Dominion Physical Therapy location in Hampton at 757-825-9446 or the Norfolk location at 757-963-5588. Thank you so much for joining us on this episode of the Community Connection presented by Dominion Physical Therapy and Associate, where we are connecting the Hampton Roads community one conversation at a time.